induced asthmatic response modified by GATA. Universidad Católica de Santiago de aquí fue un campus de What's asthma? Asthma is a common chronic inflammatory disease of the airways. Is characterized by variable airway obstruction, hypersecretion of mucus. We have a video here.
Asthma is a chronic long-term condition that can be managed but not cured. Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, for some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract. The airways narrow, and breathing through them produces a whistling sound called wheezing. Mucus is produced from the lining of the airways, which clogs up the narrowed airways further and causes coughing. This makes normal breathing more difficult, producing symptoms of asthma that can be mild, moderate, or severe and life-threatening, where hospital treatment is needed. The narrowing of the airways is reversible if the trigger is removed, or if the inflammation is treated medically. Therefore, preventative treatment is used and can be managed by the patient themselves. An acute asthma attack requires medical intervention, but the type of intervention depends on the severity of the attack. For more information,
Definition.
This animation will show what happens in the lungs during an asthma attack and how a reliever inhaler works to treat it. Click the navigation arrows below the animation screen to play, pause, rewind or fast forward the animation. Air or oxygen is taken in through the mouth and nose. It then passes through the trachea to the bronchi. Asthma is a condition where the airways become irritated and inflamed. The bronchi are large tubes which are found in the lungs. Air flows through these tubes. The bronchi branch and narrow into tubes called bronchioles. The bronchioles continue to branch and end with tiny air sacs called alveoli. In healthy lungs, oxygen is taken into the body through the bronchi and passes into the blood via the alveoli. If you have an asthma attack, you may start wheezing. Your chest may feel tight and you may be breathless. The muscles in the walls of the airways tighten and the inner surface swells, causing the airways to narrow. An asthma attack can be triggered by exercise or an allergy, for example, both of which can irritate the airways. When the airways narrow, it's harder to breathe. Reliever inhalers are used to widen the airways so you can breathe more easily if you have an asthma attack. The inhaler contains a gas which propels the medicine into the airways so that the muscle walls relax and the airways open up. When the airways widen, it's easier to breathe. This is the end of the animation. Click on the animation screen to watch it again.
The most prevalent phenotype of asthma is characterized by eosinophil-denominated inflammation that is driven by a type II helper T cell. Therapeutic target of GATA3, an important transcription factor of the Th2 pathway, might be beneficial. We evaluated the safety and efficacy of SB212, a novel DNA enzyme that is able to cleave and inactivate GATA3 messenger RNA. Applying medicine. We conducted a randomized, double-blind, placebo-controlled, multi-center clinical trial of SB312 involving patients who had allergic asthma with sputum eosinophilia and who also had the classic early and late asthmatic response after laboratory-based allergen provocation. A total of 40 patients could be evaluated. 21 were assigned to receive 10 milligrams of FeC10 and 19 were assigned to receive placebo with each study. Drug administered by means-of-form inhalation onset for 28 years. Another initial challenge was performed before and after the 28-day period. The primary endpoint was the late asthmatic response as quantified by the change in the area under the curve for the forced expiratory volume in 1 second. Yeah. Oh no,
Skin allergy, asthma, insect allergy, some drug allergies, and some food allergies. Excessive Th2 activity would also suppress the activity of Th1, and a strong Th2 response would result in allergic reactions.
For instance, no noteworthy difference in adverse events were observed between patients receiving SB010 and those receiving placebo during the 28 study period. 8 patients in the placebo group as compared with 6 patients in the SB010 group and had an adverse event there. There were no serious adverse events during the study period. The analysis of safety endpoints did not reveal any safety concerns. There were no significant between group difference in pre-treatment and post-treatment levels of TNF, interleukins, and 8. Monocyclic clemmatic proteins 1 and 4, macrophage inflammatory protein, macrophage-derived chemokine, and interferon-inducible protein 10. No significant increase in levels of inflammatory factor or anti-nuclear antibodies were detected in the group. Cons: the primary outcome is expressed as a percentage of the baseline Th1 during late asthmatic response after administration of multiple doses of inhaled SB010. Secondary outcomes were the safety and side effects possible of SB010 as assessed by evaluation and of adverse events without signs Electrocardiographic findings, laboratory analysis, and tests pulmonary functions, exploratory endpoints, induce the AUC for one during early asthmatic response, then induce change in airway responsiveness and change in FeNO and in biochemical levels in plasma and cells. Sputum after treatment with SB010. We have no idea here. Conclusion: treatment with SB010 significantly attenuates both late and early asthmatic response after allergen provocation in patients with allergic asthma. Biomarker analysis show an attenuation of Th2 regulate inflammatory response. Finally, the last video
An
here.
allergy is an overreaction of the immune system to a normally harmless substance called an allergen. Common allergens include pollen, animal dander, down feathers, mites, chemicals, and a variety of foods. On first exposure, the inhaled allergen enters the mucous membrane lining the nasal passages, where it is taken up by the antigen-presenting cell, which presents it to the T cells. These T cells activate the B cells to release substances called IgE antibodies against the allergen. These IgE antibodies sit on the surface of the mast cells. The mast cells have granules containing chemical mediators like histamine and prostaglandins, etc. On exposure, the allergen binds to the IgE antibodies present on the mast cells, cross-linking them. This results in the release of histamine, prostaglandins, and other mediators into the surrounding tissue. These mediators cause dilation of the surrounding blood vessels and increase their permeability. This results in the nasal stuffiness, sneezing, and mucus discharge of allergic rhinitis. Antihistamines work by blocking the action of histamines at its receptors and thus decreasing the body's reaction to the allergen.
This should apply in the course of 10 years consultations for asthma. They were increased from 2% to 12% in the hospital pneumological. This is attributed to environmental conditions, including pollution, presence in cities with many vehicles as Guayaquil, exposure to pesticides or insecticides, and these methods embedding carpets and furniture. Besides pets, humidity, cigarette smoke falling from plants, paint, chlorine, and the